I'm here today at the Health and Hope Clinic, which is one of our closings for charity, and I'm here with my friend Sally Burgash. Welcome.
Thank you.
We want to know a little bit more about the clinic, what it does, and who you serve.
So we're a lot like a Doctors Without Borders. We have up to 330 volunteers now that are volunteer doctors, dentists, nurses, surgeons, and then we have a lot of non-medical volunteers. So anybody that wants to give back can volunteer with us, which we always love. And then we have 1,414 unique patients, which means we only want to count them once. So some of them come every week, some of them come monthly, some of them come twice a year. So 14 patients. And we did over $5 million in free medical care, dental care, mental health, the full gamut, and then we have a full pharmacy, licensed pharmacy.
So over 1,400 patients you are serving here, and who are these patients?
So people always ask me that. We have a lot of the working poor, that people that maybe just make enough to put food on the table, but not enough for extras like they consider health care. And then it's about 50-50 of people that maybe don't work, or maybe they were laid off, or maybe they have such chronic condition that they can't work. And then we have some homeless population as well. So we have that full gamut of people that we serve.
Who are underinsured or no insurance.
They cannot have any insurance, and they have to make 200% federal poverty level or below, and they have to live in Florida.
Well, and if you're trying to break that cycle and move out of poverty, your health is the most important thing. So thank you for the service you're doing and help these people get to where they need to be in life. So you talked about the donations and how much you're receiving, but what help could you need? If someone's watching this and they're like, I'm really mesmerized by what you're doing, I want to get involved, how could someone help you here at the Health and Hope Clinic?
So we love being adopted by organizations, so maybe like Rotary clubs and different church groups, some of the Mardi Gras crews. We'll be adopted by anybody. We'll take you. And we do beautification days at our campus because it's very expensive for like lawn service and the upkeep. And so that's one of the things that we engage our volunteers to do. Then we always need paint touch-ups, and we'll keep them busy for a full Saturday. So we love it when we have groups that ask us that question and we come up with big projects for them. But we also have a lot of need just for our patients in this waiting room. So we love it when people offer to make up some hygiene packs for us, or donate all those little shampoos and conditioners and soaps from the hotels that people that are fortunate enough to travel get. And then we just always have continual needs. One of our biggest expenses is office products, for example. So I love it when I get even like a office that calls me and says, hey, we're upgrading blah blah blah, and you want our pens and our staplers and staples, and that is very expensive over a course of a 30-day period. So when you're a little nonprofit, every single penny matters.
And what about financial donations? I'm sure you would appreciate those.
We do appreciate those. So we have a website, www.healthandhopeclinic.org. And that's where you can go on and donate. You can donate monthly. We have some people that even just give $5 a month. And I love those people because I think it's their heart that matters the most. And so that's neat to see. And then we have a once a year fundraiser. It's called Christmas at the Clinic Gala. It's at the Pensacola Country Club. We do it always the first Tuesday after Thanksgiving. And it's just really neat to see the community come out for that with their sponsorships, and just all for a good cause of raising money for our patients that we serve.
So if someone wants to get involved, how should they reach out to you as well? If they have something they want to donate besides money, or time to donate, or they're a doctor or dentist or eye doctor and they need to come and want to come and volunteer, how should they reach out to you?
They can go right on that website, or they can call here. So our number is 850-479-4456, or they can go back to that website, and we have different forms for different ways that they want to serve. But it all starts with them just saying, I want to serve, and then we immediately send them the application and get them engaged. We are all about whole patient care. So this is not a clinic that just does the acute care and puts you back out on the sidewalk. We are about the continuity of care and the overall health outcomes of achieving better health. So we have Dr. Erin Mayfield that does all the cooking classes at Everman's. She does one-on-one consults and does cooking in our lobby here for anybody. You don't even have to be a patient. We have the tobacco-free classes with Carol Knight every Thursday at 11. You can be anybody that can come. And then we have mental health group counseling in addition to all of the counseling sessions and the primary doctors that can prescribe the meds. So we have that full gamut of care, that wraparound care that is so essential. And then we have a partnership with the American Heart Association, where we're on our second year of getting fresh fruit and vegetables from our local farms. They package it and deliver it the first and third Wednesday of every month. And they asked us to identify 50 of our most chronic patients, and they make little recipe cards, and we're teaching them how to eat healthy and improve their overall health outcome.
Well, thank you so much. Thank you for everything you're doing in the community, and thank you for the impact you're making in these people's lives.
Thank you for what you guys do as well. We appreciate you all.